Hello cruel world, my name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Today I'm going to answer more of your questions from the Tinterweb. Let's get straight into it. Question number one. What does borderline personality disorder look like to a mentally healthy person? That is a good question. The first thing I'd say is I don't claim to have borderline personality disorder, but I have helped in the assessment and rehabilitation of possibly a good couple of hundred patients with this diagnosis. So firstly, let's talk about some of the features. So somebody with borderline tends to have kind of unstable and uncontrollable emotions, and sometimes that can bleed into their day-to-day behavior. They also have a problem with their self-image. Specifically, they have like a fear of being abandoned and want to be part of something. They generally tend to have unstable moods and massive mood swings. So those are the features, but what does that look like? Well, the first thing I'd say is that people with borderline can be absolutely stable. They can be stable for weeks, for months, but inevitably down the line at some point they're going to explode. So we all go through things that piss us off and frustrate us in life. Somebody with borderline is more likely to suddenly explode, get really angry, sometimes kind of out of proportion of the situation, as they themselves will realise afterwards. They tend to kind of never be fully happy, so they might be content for short periods of time, but often they feel like something is missing deep down. They tend to have explosive relationships, so frequent arguments. They can be very passionate and they can be very loving, but they can also be very argumentative at times, usually with people that they love. And also they often have problems with deliberate self-harm. That can be in the form of overdoses, cuttings, sometimes drug and alcohol. Having said all that, people with borderline personality disorder can get better with a bit of insight. Also with age, people tend to improve with those behaviours. If you're listening to this and you have borderline personality disorder, salute to you. I hope you're containing it. I hope it's not taking over your life. Please let me know about your experiences in the comments below. Question number two, how do you manage schizophrenia without ending up in psychiatric hospital? Well, firstly, it's very, very possible. So in fact, I would argue that there's more people with schizophrenia in the community than there are in hospital at any one time. I've mentioned schizophrenia in different episodes very briefly. It's an illness where the sufferer has periods of psychosis, temporary periods, and psychosis usually is in the form of hearing voices or having delusional beliefs. So to manage your schizophrenia and staying out of hospital, obviously a huge benefit is if you take your medication. So if you stop taking your medication or lower the dose, especially if you do it abruptly, then the chances are, not necessarily straight away, but a few weeks down the line, your symptoms are going to resurface. Also, you have to engage in therapy if that's what has been organised for you. So that'll help kind of let you know when things are spiralling out of control, and also help you kind of process anxieties or destabilizers that are bothering you in the community. The other thing is to stay away from destabilizers. So these are different to different people. Drugs are a big one, especially cannabis and amphetamines. Other destabilers might be certain relationships, might be certain areas or certain people that get you into trouble. And I think the final thing is to make sure that your mental state is being monitored. So schizophrenia, generally people, when they're becoming psychotic, they're insightless, so they don't know they're becoming psychotic. Their experiences, the voices, the ideas feel very real. So you have to have somebody to look out for you, and that can either be your doctor who knows you well, your psychiatrist who sees you regularly, or it could be like a family member who you know and trust who will tell you that your thoughts are starting to become awry. So you do all those things, then absolutely it's possible to stay out of hospital. Sometimes people need short admissions for a crisis, so only a couple of weeks in hospital, which obviously is much better to do that, to nip it in the bud, rather than your illness deteriorate and down the line you get very ill and you need to spend weeks or months, possibly even years in hospital. Nobody wants that. So doing all those things can prevent that happening. Question number three. My fiance used meth for 2 years and he was convinced that somebody was bugging him, controlling his mind, and he would hear multiple voices in his head. He keeps going on about this non-stop. He won't give up this delusion. Why? Yikes. That does not sound like a good situation, I have to say. So there's a couple of things that could be going on here. It could either be a drug-induced psychosis. So people who are predisposed to psychosis, when I say predisposed, they have other factors, like they have the genetics, often flip into drug-induced psychosis. So that's a temporary state, which usually lasts about 3 or 4 days while the drug's in the system. It's renowned for certain substances, so really strong cannabis like skunk, amphetamines including meth, might cause this disorder. The good news about drug-induced psychosis is it's generally temporary, so I couldn't really tell by the question how long the delusions have gone on for. If they have remained even though your fiance has stopped taking meth, then unfortunately it sounds like he's started with drug-induced psychosis and flipped into a chronic psychosis like schizophrenia. I'm sorry to say, but it's unlikely to go away on its own. It's possible, but it's unlikely. And the longer it exists without treatment, the less likely it is going to assuage by itself down the line. Hate to be a party pooper, but he really needs to stay off the meth. In fact, I think that's a life tip I can give for all my viewers. And back to your fiance, he might need treatment, he might need hospitalization. I guess that depends on the intensity of his delusions and his other symptoms, and it depends on the level of risk. So if he's functioning, if he's relatively stable and content, then he might not need treatment. But if it's bothering him, which it sounds like it is, then he almost certainly needs an assessment, and he might need medication, and he might even need a hospital. Sorry to be the bearer of bad news, but I hope that helps. Question number 4, is anxiety disorder a mental illness? Well, anxiety is not a mental illness in that it's something that we all experience when we have stresses, whereas anything we're worried about is very natural. However, anxiety disorder, and I would say there's lots of different types of anxiety disorder. So let's take the most kind of common one, which is generalized anxiety disorder. By definition, it's when somebody feels anxiety to a degree that is impinging on their level of functioning. So for example, they're worrying about things way out of proportion of what is appropriate. They overthink things and they constantly focus on the worst outcome. They can be quite indecisive in life. They have an inability to relax, and that leads to some physical and functioning deficits, such as feeling tired all the time. Not being able to sleep is a huge one, so usually not being able to get to sleep is the most common, and less commonly, once you're asleep, waking up frequently, which obviously contributes to fatigue. And then you get physical symptoms like palpitations and sweating. So if that is happening on a regular basis and it's impinging on your life and you can't function, you're unable to do your work, for example, you're unable to enjoy a normal, happy family life, then by definition, then that's a disorder. There are other anxiety disorders, so phobia would be one, which is a fear of something very specific, so you avoid it. Panic attacks would be another one. So yeah, so once it crosses that threshold, then by definition, it's a disorder and it's all about functioning. And I suppose that's kind of the same for most mental disorders, really. So depression is another example. Some people might be a bit melancholy, but that's not a mental illness. It's when it crosses that threshold into actually affecting your life. So you're not going to work, you're thinking about hurting yourself, for example. So I'd say in all psychiatric disorders that are neurotic, they're all versions of everyday experiences, but once they pass that threshold, they become disorders. Psychotic disorders, like schizophrenia, on the other hand, are symptoms that are not, quote unquote, normal. So hearing voices, for example. Anyway, that's enough of that. I hope this was educational. I hope I answered some of your questions. Please subscribe to this channel. It's called The Psych for Sore Minds. I dissect a whole range of mental health issues, some to do with offending and violence, because that's my speciality, and some like this one that are more for common mental illnesses. I interview ex-patients. I talk about individual high-profile cases, diagnoses, etc., etc. You know what it is. Please check out the rest of my videos. Please subscribe. Stay thymic, and whatever happens, please remember, I love you.